So I'm Isabelle Hagner. I'm the Public Health Director for Africa for International SOS. And I started just over 2 years ago with them after a career both in diagnostics, where I was the Marketing Director for Africa for Abbott Rapid Diagnostics, and previously working on various programs in Africa for humanitarian aid and healthcare. And if my slide could come, that would be great. So International SOS was founded nearly 40 years ago. It is a private sector organization. Yes, best kept secret with 13,000 people worldwide on our payroll. And more importantly, 5,400 are medical professionals. So International SOS is sometimes well known for its medical and security risk management business, which is only 30% of our business. The rest is actually split in advisory services, technical assistance to governments, for example, and also deploying community health program, often alongside private sector partners, which are extractive industry stakeholders, for example, in remote areas. So in Africa, we've been here on the continent for just over 30 years. We have 15 clinics in various countries, such as Ghana, Nigeria, Angola, Madagascar, Chad, Mauritania, and Mozambique. But we also have 165 medical sites, which are most often in very remote areas where we support the staff of our corporate clients, but where we take the advantage of having that very special relationship and our medical staff already on site to suggest and to drive community health program around those operational sites. And today's subject for our panel is the role of private sector in disease surveillance and response. And just FYI, International SOS, one of our medical doctor in Nigeria, was actually the first one picking up the first COVID case in Nigeria, Dr. Alison Amara, in 2020. So well done to her. So we're participating to that effort already. When we look at pandemics and epidemics, they are very costly to fight. Everybody knows that. They have a big impact on economies. And expenditures for prevention and preparedness are often measured in billions of dollars. But the cost of a pandemic is in trillions. So we need to also equate what can be compared. Currently, COVID-19 is estimated to have cost the world about $11 trillion. And the World Health Organization had stipulated a couple of years ago that it would take about 500 years to spend as much on investing in preparedness as the world is losing due to COVID-19. So we really need to consider healthcare a little bit more seriously and more as an investment that has a return on investment rather than an expenditure. And to make it real, just to give a little bit of background, it's not just lives that are at stake, obviously. It's also education. It impacts education. As you can see on this slide, a few indicators, both in the Ebola outbreak in West Africa in 2014 and in the COVID-19 pandemic. It is hundreds of hours, months of schooling that have actually been missed by children. So we are not only paying the price of today's social economic impact, etc., we are paying the price of tomorrow of not having our children being well educated because they're still at the mercy of the countries not being able to respond and to have a proper system in place to manage those pandemics. So we have heard various sessions on how important the private sector support is in building responsive, resilient, and sustainable systems for the UHC agenda. But of course, the recent COVID-19 pandemic has reinforced the urgent need for a better prepared and more responsive system, but also for an actual operationalization of multi-sectoral, whole of government, but also whole of society system. So it is not just a public versus private, okay? It is also a One Health approach to the response that is required across health, animal health, environment, R&D, financing, social protection, education, supply chain, service delivery, in consultation with the private sector and civil society. So I will welcome now Dr. Kingsley to present a few slides on his insights on the role of private sector.
Thank you very much. Before I commence, I just want to make this comment. Honorable, the former Minister for Health in Kenya, did mention that, well, during her session, she was the only female among 3 males. And now I'm the only male among 3 females. So I don't know the method that was applied here, whether it was random sampling or stratification or whatsoever. But I think it's a good one. Right, so maybe if we are still waiting for the slide deck so that we don't take our time, I would have actually preferred a roundtable discussion, but it's also good that we were asked to develop some slides for this. Well, for the private sector response, it's on now. All right, yeah, I just want to let us know 2 elements are involved here. One, we are talking about the private laboratory sector and the organized private sector for health. Now, talking about response, private sector response to pandemic and the surveillance, I'll also be looking at the 2 perspectives, from the private sector laboratory service providers and the organized private sector, which are the investors. The next question might be at the end of my presentation for us to decide and look at it whether they are actually organized or not. So we said that private health sector offer very quality products and services that consider the needs of all people. There's no segregation of gender here, poor, underserved populations, marginalized, and whatsoever. They just provide quality health services that should reach everyone. But in my country, Nigeria, this sector contributes to over 60% of healthcare services. And this core offering of demand-driven product and service is the greatest contribution to universal health coverage in my country, Nigeria, and I'm sure that it applies also to some other sub-Saharan countries. Next slide, please. Yes, I can skip this, but let me just mention that out of 46,608 healthcare services in the country, about 5,958 are private hospitals. This is outside the standalone laboratories, which are about 3,700, based on the record of the Medical Laboratory Science Council of Nigeria. Next slide, please. Yeah, the role, quick one. In a country that is facing diverse healthcare challenges such as Nigeria, and which also applies to several other countries within the African continent, it is very important that we understand, recognize, and harness the potential of the private sector in safeguarding public health. Public health is a responsibility of everyone. So first, their role is complementary. For the private healthcare services, alongside the public institutions, they provide essential health services. They expand the reach in terms of testing and escalation of testing, menu, and devices within the health system. Their involvement ensures a comprehensive coverage, and they contribute to a multi-sectoral approach to disease surveillance and response. Next slide, please. Yes, the role also includes early detection and notification. Of course, detection can happen at any facility, but the most important thing is that the notification must be prompt and early, must be timely. And then they also have a responsibility in scaling up. Of course, public health facilities for testing and diagnosis do not reach out to the primary healthcare setting, where you have the majority of the population. So the private sector laboratories stand in the gap to escalate testing, particularly with rapid diagnostic testing and all that. They also do prompt reporting, and then They have also very good data system within their setting. And most times, there is effective monitoring of potential outbreaks, which is organized by the private sector. I'll give us an example in 2014, when the index case of Ebola coming from Nigeria, the public sector was still in coma, not knowing what was happening, but it was the private sector that detected the Ebola and notified government about it. That was before the establishment of the Nigerian Center for Disease Control. Next slide, please. Now, the private sector also contributes to rapid response and treatment. I've talked about this before in a milder form, but I want to mention here that they have a robust system for rapid response. They are flexible to the needs of society, the needs of the community, the needs of the healthcare system. Some of them have the infrastructure, they have the expertise, and they have resources. I'm still going to talk about resources here because they can easily mobilize this for prompt response to provide diagnostic testing, confirmatory tests, critical care, treatment, and management during emergencies. So in my country, they are a major and critical stakeholder in pandemic response and emergencies. They also have very good data system. Of course, you know that when a private sector wants to do something, it does it well because it does not have restrictions to operate. As long as the resources is there, they have very good digital data collection and management system. And they're also aligning with the strategy of government. So currently, we have the Nigerian Center for Disease Control that is coordinating public health response for emergency, pandemics, and emergency preparedness. Under the coordination of my division, the National Laboratory, that's the Medical Laboratory Services Directorate in the Federal Ministry of Health. Of course, you know that all the agencies within the Ministry of Health report to the government. And then the apex executive in the government with respect to health matters in every country is the Minister for Health, whom I report to. So, but we have observed that the private sector in terms of data collection and data gathering is very efficient. And we're also leveraging on that. So next slide, please. Community engagement here is very important. They are closer to the people. They have the reach, and they're able to move. They are flexible in reaching out to local communities, making themselves known, announcing their visibility, and ensuring that preventive measures, contact tracing, which is very important, is carried out without encumbrances. They have the means, they have the reach, and they're also committed to ensuring that the country brings all pandemics under control. And we saw the example with the COVID-19 that we've just been able to put under control. In terms of innovation, research and development, yes, the private sector has the capacity. Of course, sometimes with collaboration with government, but most times they go all alone. And you all will attest to the fact that why the struggle to bring COVID-19 was giving countries worries and all that. The private sector moved ahead and we developed the vaccines. Was there any country government or the public sector in any country that developed the vaccine? No. Country only provided enabling environment. It was the private sector that developed all the vaccine. And all the vaccines that we are mobilized for use, we are developed by the private sector. That's the extent for which they can go in terms of research and development of innovative devices and medicine. So the private sector is very key, which we will always advise that countries, the public health sector should leverage on. Now, next slide. Vaccine production, I just talked about it. Private pharmaceutical companies, they are there. Even as we talk now, there's a lot of research going on several other diseases of public health importance. That research is ongoing, not by government, it's a private. The government can only collaborate with you because sometimes the government comes and the government goes. And particularly in Africa, in Nigeria, we used to say, soldier come. Soldier come, soldier go, but the barracks remain. So the public sector there's a high attrition of experts within the public sector, because you must move on. By virtue of promotion and mandatory years of service, you move on. And so that dynamics of movement within the public sector is also not helping in sustainability of programs within the public sector. But the private sector have their strategy, and they move on and they run with it. And they are getting results, they are getting deliverables. So we can see with the example of vaccine production, even with the vaccination exercise, with the development of test kits, testing devices, and now talk about molecular testing platforms for genomic sequencing and all that. Was there any just if you know a country that developed one, just raise your hand and I'll ask you to tell us. It was the private sector. They are the big-time players that have done all the research and have been able to develop products that are useful for us today. Products that have enabled us to be able to unravel the underlying genomes of any virus that is responsible for any pandemics anywhere in the whole world. It's the private sector. So that's what we will always advise, that we leverage on their expertise, leverage on their flexibility to be able to conduct research, leverage on the ability to mobilize resources, and then work together as a team. What is lacking is that coordination, which I'll be talking about when we get to barriers. So next slide, please. Yes, representation and contribution in policy making. Well, the first night we had a meeting and said, private sector, you have enough capacity, to be able to effect a change or induce a change. If you cannot effect the change, be a catalyst to induce the change. So, how are you going to do it? Ensure that you get organized and be on the table with the government, because that is where policies and guidelines are rolled out. That's where protocols are rolled out. Recently, when the Ebola pandemic came on board, I know that in my country, the president rose to the occasion, set up a presidential steering committee on COVID-19, and they developed many protocols. Now, if the private were not involved on the table when decisions were taken, when the process for the development of those protocols were not taken, then whatever has come out and is being endorsed by the government becomes implementable, whether it favors you or not. So that's why it's important that you must be at the table, such that whatever policy that government wants to roll out, you be part of it. And you also look at the policy line by line, again, to agree that that policy will speak to your overall interest, the overall interest of the public, of the private sector. Otherwise, government might just be mindful of the technical advice of technical directors and technical experts within the public sector setting. But we also know that the private sector has acquired so much skills, so much expertise that we cannot ignore. But if you stay away from the point of policy making, formulation, and development, then you are undoing yourself. So it's very important the private sector must understand they've contributed so much. They are working strongly in collaboration with the government in my country. But I want to advise that every other country should imbibe that lesson, that whatever comes out from the table of government as a policy direction is to be implemented. We also in my country have developed the National Strategic Health Development Plan. We are in phase 2 of it. And the private sector participated actively. That plan spells out all the pillars for implementation and all the strategies that the country wants to implement in the next 5 years to be able to strengthen the entire health system in the country. Now, added to that is that we've also brought out the National Health Plan. The National Health Plan was also drawn from the bigger strategic plan. So if the private sector were not there, then whatever comes out becomes implementable until the next 5 years when that document will be due for a review. In any case, within the next 5 years, a lot of dynamics and changes would have taken place in the society. Next slide, please. Yeah, so some barriers to private sector involvement is that lack of trust, particularly in our African countries. Lack of trust and perceived insincerity. You can't take that away. It's in our blood. and I pray that God will roll it away. There's the legal restrictions that limit surveillance, pandemic response, and services in health emergencies to the public sector and other policy bottlenecks. I give an example of my country. Most of us here are aware that we have a private facility, which is the African Center for Genomic Surveillance for Infectious Disease. It's established by a private university, the Redeemers University. One will also know one Professor Tomori was the pioneer vice chancellor of that university. That facility has capacity that is greater than the National Center for Disease Control in terms of pandemics, response, surveillance, and all that. But what are we doing? We have a legal framework that has placed the responsibility for public health response and management of public emergency on the Nigerian Center for Disease Control, which is the Nigerian Center for Disease Control. Now, the NCDC is now saying, African Center for Genomic Surveillance and for Infectious Disease, come under me. All your data must come here. Whatever strategy you want to do, I must endorse it. And in endorsing it, you are restricting their movement. You are restricting their development, and you are also restricting them escalating their services. But I tell us, this center is WHO accredited in the other laboratories, and they are supporting other West African countries in pandemic response. But within the country, NCDC does not recognize the role they are playing. This is what legal restriction can do. So that lack of coordination. I've said before that the private sector has enormous capacity and capabilities. All we need is a coordination mechanism where the public sector representing the government will coordinate them properly. Then poor funding mechanism, ineffective accountability and transparency is another thing. Everything coming from the point one, which is lack of trust and perceived insincerity. Next slide, please. Then we have opportunities to strengthen the role of the private sector is that there must be increased investment in the private health sector. So that is important. We must improve coordination between the public and private, development of standard training and education program for health workers. And then we have the National Medical Laboratory Strategic Plan, which has also spelled out areas that require private sector investment within the Nigerian laboratory space. Next slide, please. These are opportunities for investment. Now, before I conclude, one question was asked. That question is, what is your take? One major role that you can talk of that is a priority for private sector, in public health response and emergency. And I tell us, resource mobilization comes first. For talking about private laboratories, detection and notification is key, but we'll talk about organized private sector where the investors come in. It is resource mobilization. And I give us the example of COVID. When COVID-19 pandemic broke out in my country, government was not prepared. There was no fund in government budget for emergency response. Even if there are some fund for miscellaneous or sundry expenses, it was inadequate. So the country was at a loss. Where are we going to start from? What are we going to do? It was the private sector. They formed an alliance, which they call CACOVID. And I'm sure most of us heard about it. CACOVID is Coalition Against COVID-19. Under a very short time, they were able to mobilize huge resources that government was really, really embarrassed. In fact, government was so amazed that this is what private sector could do. They were able to mobilize enough resources. With that resources, they were able to support testing. They were supposed to support treatment and care, management of patients that were infected. They had to go for case management and all that. They did all that. And not only that, they were able to also procure palliatives because there were restrictions of movement, markets, and all that. So they were able to also procure goods, including foodstuffs, medicine, that they distributed to the population. So that is what private sector can do. And we must always leverage on their capacity to be able to make a difference where government is taking unawares in the event of any pandemics. Thank you.
Thank you so much. Thanks a lot. Lots of passion and a lot of insights, and also a little bit of a challenge, ladies. So on a panel where we are heavily represented, you're going to have to catch up for that time. So let's try to rise to the challenge of having ladies speaking less than a very passionate man. Thank you so much, Dr. Kinsley. Mary.
Perfect. Thank you, Dr. Kinsley. I'll try to be as short as possible so that we can catch up with time. Slides, please. So I'll just go briefly to what happened to the COVID pandemic personally. I live in the Netherlands. Yes, I'm part of that brain drain that we're talking about. And so when COVID-19 pandemic hit, and I was getting my second dose of the vaccine for the COVID, my mom, who is asthmatic, old age, living in Kenya, could not get even her first vaccine. So my question is, what's the role of the government? What's the role of the donors? What's the role of the private sector in terms of pandemic response? So I'm going to dive directly into who we are. I work at the Access to Medicine Foundation. Again, we're based in the Netherlands. We are a research-based institution, independent. I have to be very precise on that. And we have been analyzing for the past 20 years the actions that the industry put in place so that they ensure that their products are accessible, available, affordable, and of good quality to people living in LMICs. We use our research insights to actually push the companies. We get a lot of questions. So how do you do this? How do you push the companies? This is the industry. The industry will never move. They will never change their business model. I'll explain our methodology in that. One slide, go back a little bit. So we are funded by the Dutch government, the UK government, Bill and Melinda Gates, and the Hamsley Charitable Trust. We do not get any funding from the pharmaceutical companies themselves. So what is our framework? What kind of, how do we, next slide. So how do we move the companies? So our target is to ensure that these healthcare companies are moving to address issues of inequality, issues of lack of access of products, essential healthcare products for people living in LMICs. So our output is our data. So we publish a lot of reports in, be it at global media, we publish reports with a lot of organizations working hand in hand with like MPP, the United Nations, the WHO to publish some of this report. We engage directly with the global health stakeholders, government, we work with investors, next slide. So we're currently working with around 138 investors who are managing around $22 trillion. And what we do with these investors is we are sensitizing them about access and why they should be holding the industry in itself responsible in terms of engaging and trying to figure out how and when they can participate in mitigating some of the key issues in access. Next slide, please. So when we look at our research programs that we are currently working on, so we are researching, working with the big R&D-based pharma companies. We are analyzing generic manufacturers. Aspen is also one in our generic medicine manufacturers. We're working with medical gas companies, diagnostic companies, manufacturers, all in one aim, trying to improve access, trying to mitigate issues of inequality. Next slide, please. So companies that we're working with right now, today I'm going to highlight only on one of our research findings, which is the Access to Medicine Index, where we analyze 20 of the big R&D pharmaceutical companies. So we're talking about the J&J, the SK, I've heard some Roche, MSD, Gilead Sciences. We are all analyzing them in the Access to Medicine Index. And why we chose these 20 of these companies is because of the market share, of the global market share. They hold the highest percentage of volume sales. If you want more information, please just go to the index, Access to Medicine Foundation, and you can see how we are analyzing the generic manufacturers, the medicine, oxygen, and you can see various reports out of it. Today, I want to, next slide, please. So within our countries of scope, we are looking at 108 countries. So you had an engagement lead working with within African continent, the South American and Asia, because those are the countries that are under our scope. Next slide, please. So we're talking about pandemic response. So what did these big pharma companies do? We need the data. Data will help us to understand what worked, what did not work. Because when the next pandemic hit, or will hit, yeah, we need to know, look at what has happened in COVID-19 and trying to either replicate or become even better in terms of responding to this pandemic. So next slide, please. So one of the key roles of these big R&D companies is engaging, of course, in R&D. So in the Access to Medicine Index, which is published every 2 years, we look at 3 technical areas. One, we look at governance of access. Is access recognized at board level or at CEO level? That is important, because we found that if this is actually important, then the business model within the companies is going to change. Second areas that we look at is exactly at R&D. So we did look at some of the, what is in pipeline of these companies. Are they addressing diseases that disproportionately affecting people in LMICs? And what you see here is the diseases that WHO has classified as diseases for R&D priorities. These are diseases that has the potential, of course, in the next pandemic. And what you see when you see on the R&D project, so 2018, there was practically nothing. And then 2021, the COVID pandemic hit. You see 63 R&D projects were already in the pipeline out of 17 companies. And in the last publication of the 2022 Access to Medicine Index, we still see companies are engaging in R&D of be it therapeutics, vaccines, diagnostics, or platform technologies for against the COVID-19 and other coronaviruses. The same we saw also with the Ebola. But what was a little bit shocking for us is the fact that the pipeline is practically empty for other diseases that have a potential to cause the pandemic. So it is the role of these big R&D companies to invest in research and development of these other diseases that have a potential to cause a pandemic. Next, please. We talked about building of resilient supply chain, and in the morning we were talking about the local manufacturing capacities, about the technology transfers, about voluntary licenses. So what we did within the period of analysis of Access to Medicine Index 2022, we were able to map out what are some of the technology transfers that happened. And what we found is, of course, most of the technology transfers were happening in India and South Africa, Brazil, because this is where already there was environment for the uptake of these technology transfers. So in the future, we would love to see, yes, we have to understand there has to be an enabling environment for the uptake of the technology transfers. But then we would love to see more companies taking part in doing technology transfers and also building the capacity of local manufacturing in these countries, be it in Africa especially. Next slide, please. We also saw a lot of initiatives. I don't think I'll be able to get into these slides, but what I wanted to say is it was not only about R&D, or it was not only about these big companies taking part in the building of resilient systems, but we saw them partnering with governments. We saw them partnering with the NGOs to try to strengthen health system and disease surveillances. Next slide, please. So what are the lessons learned? We can go to the next one, please. So 4 key lessons were learned from our analysis, and also we held what we call an Amsterdam session in 2021, where we brought all these 21 companies together, global health stakeholders, investors, in what we call the Amsterdam sessions. And they highlighted 4 key takeaways from this pandemic. One, what they found was very essential is that strong pre-existing relationship really helped in the response of the pandemic. Number 2, they found that really multi-sectoral collaboration was key. So governments work with NGOs and with working with other private sectors. Ministry of Finance, for example, was also highlighted as key. Building of very resilient supply chains was also very important for them. And of course, expanding of local capacity was also key, and enabling that environment. So there is, of course, the role of the private sector when we're talking about pandemic response. My worry is, have we learned, or is it gonna be with next pandemic hit and we're like, oh, and we're all over back to ground zero? Thank you.
Thank you so much, Mary. And indeed, it is an interesting concept to say we need to invest in R&D and developing products for the potential pandemic, upcoming pandemic. There's a lot of those diseases like Ebola that doesn't attract so much funding and research and development, but there's a very good reason for that also as a manufacturer. How do I sit on a product that may or may not trigger a pandemic and may or may not be contained before I even get the first batch of product out? So it is a very, very tricky situation. But with no further ado, Dr. Alama.
Hi, everybody. I will try to be more fast. Okay, my slide, please. Thanks to you both. Slide. Okay. Thank you. Then I will say I will give information just to complete what they said. Okay. Slide, please. Okay, we will start by an overview just about our unmet need in our countries in West Africa. But I think that we have practically the same problem around Africa countries. We used to say health has not price. Is that true or false? Health has not price. But I think that they forget to put that the health has a cost. But now, who will support the cost? We will try to explain and to talk about the place of the private sector on the cost of that health. Then in Africa, we have some problems. We have some problems like, first, leadership and governance. We need to improve our leadership. We need to improve governance to make better our health system, management and coordination. But we have also a second problem, which is the important problem that we don't use to talk about. We don't use to talk about enough, is the trust of our population in our health system. It's a big problem in an economical aspect. Why? Because when they are not believe in our system, what they used to do, they will take their own money or private health insurance money or social security money to go to other countries and for a good health there. And so the solution is probably universal health coverage. We don't have it yet. And we have also a problem on regulation and reglementation law in our global healthcare system. What's the problem we have because of that? We have a problem of equity, of quality, of healthcare system access, healthcare access. Next slide, please. Sorry for my English. If you don't understand, don't be free. Okay. Now we are okay. We are going to talk about the place of the private sector, public and partnership of public and private sector, how it can be useful for disease surveillance and pandemic response. Next slide. Let's talk about surveillance. What is surveillance exactly? Data collection, analysis of this data, and interpretations. That it depending directly of the accessibility and the quality of healthcare, medicine, and a good database to present, treat, and follow up disease. Next slide, please. Pandemic response. Pandemic response, it depends on three things: preparedness and response capacities, surveillance and prevention, medicine and vaccine access. But it's not only the one, or it's not only the one challenge we have in pandemic response. We have also a challenge which is how to continue to provide health care during emergency period. Then we have to ensure supply chain of essential drug and vaccine, also manufacturing. Next slide. How private can be useful. It's all about money. It's all about cost. Infrastructure is about cost. It's about money. We have not enough money, but we have some. We have not enough infrastructure, but we have it. Private sector is existing in our country. It's growing fast. And the partnership between private and public sector is existing and applied since several years. It's not an innovation. We all know that. But today, we know that it's the best financial and economic model for our system. Then we know that private is the richest, that is true. They can get money easy. And public is the poorest, but they're still the final decision maker. Next slide. Then how they can be useful? Financing. Financing what? Infrastructure. Financing infrastructure like hospital, like pharmaceutical industries, not only private, but for public. They can also reinforce the public offer, but they will put money inside for public health, where public health have to stay and be owner there. And they will invest in the private sector to build infrastructure, also laboratories, or all we can imagine to reach targets for disease surveillance and pandemic response, to come complementary for public offer. Next slide. For that, we have to make public sector needs and populations' interest as priorities. We have to put ethics and deontology of the center of our target. Here is one of the most important. I love the last one. Competition law between public and private sector. We have to define exactly what will be public mission and private mission. They have to stay each one and focus each one of their target to get and to reach public health target for the future. Next slide, please. Then we are all okay today that it's the best financial model for our system, but we have to keep that private have not take place of the public, but the first one must and have to help the second one just to grow and to get public health target. Political strategy must be there in order to farm and avoid all mismanagement and for competition from one sector to another. Then, because there is a risk of missing from some target of Africa's new public health order. And we have to make the best choice of the type of PPP agreement by needs. It's very important because partnership between public and private sector, it will be made by step. And in each step, every step, we need to be very strategic and make the best choice of agreement, because target is what? to ground public sector, because for the accessibility of healthcare, we need to improve public system offer. Thank you.
Merci beaucoup, Alama. And all that talk about money reminded me of a very good say from Dr. Amit Thacker, who said in one conference, he said, it's, private sector is called for profit, but in fact, they should be called not for loss. And I really like that. Avanti.
It's a perfect segue to the private sector. So good afternoon, everyone. And thank you, colleagues, for all the insights. Luckily, a lot of it is duplicated, so I won't take too much of your time. I represent an organization called SAMED. It is the medtech industry in South Africa. We consist of, you can just run the slides as I speak. Thanks, next one. We represent several medtech companies in South Africa, and we have about 180 companies right now, with about 8,200 employees countrywide. Of course, just to let you know, when COVID happened, our industry was at the center of it. Whether it came from PPE, whether it came with the diagnostic testing that was required, or even the devices and consumables required for vaccination. So we were really in the center of this pandemic all those years ago. We are fortunate enough to join the Business for South Africa platform very early on in its inception and carried through the process of the COVID response. And today's talk really is about some of the learnings from there as private sector and some of the actions we've taken through for any future pandemics that may happen. It's really very, very practical highlights for us. And I've taken just 3 areas that I thought we would focus on this afternoon. Next slide, please. The first one, and many of my colleagues have spoken about this previously, I'm sorry to block you, let me stand here, is the one on information and data. And what we found on day 1 of the B4SA platform, actually, and you can stop there, thanks, is that we didn't have, I'd say, usable and useful information about what the current situation was in South Africa. So a practical example would be, what is our current availability of gloves in country? It was such practical questions. We didn't need percentages, we just needed to know, did we have gloves in country? If we didn't, were gloves coming to the country? And that kind of information could not just be gathered by the private sector, because of course, in this multi-sectoral industry that we're in, we had to derive this information from various sources. The other thing, of course, practically is companies were closed. So you could pick up the phone and say to one of our member companies, you import gloves, how many do you have in warehouse? Nobody's answering the phone. So we realized that from that point, basic information about what products and services were available to do a situational analysis and then a gap analysis within a couple of hours was required. What we did do then, and very, I think, successfully, is we had to combine all this information from the various sectors. And that was where the platform was incredibly helpful, because different sectors have different sets of information. And I think it took some time, but we managed to get a very good spreadsheet. It was quite a simple Excel spreadsheet that said, this is the glove situation, this is the syringe situation, in which province is it in, and where can we get it moved or located. Just in terms of the future and how we look at information, what we've decided as an industry to do is to gather this information up front. So again, practically, which are the companies that are either producing locally or importing these kinds of items? A list of items, so pandemic tomorrow or the next day, we're not searching around for this information. So those are the kind of future collaborations that we're doing with government and NGOs to try and get basic information that can practically be used if a pandemic has to happen or when a pandemic happens. Next slide, please. The next one, and this is a big one, was local capacity. And I talk about capacity again in products and services. We knew some time before that we did have a syringe manufacturer in South Africa. Some of you may be aware that we were producing our own syringes, and we thought, well, let's phone this company because we started doing the vaccine rollouts. They stopped manufacturing over 6 months ago, and importation started again. And there were no syringe manufacturers at the time. And we then got into, well, why are we not manufacturing those very simple, basic things that we don't need to import? It's a much longer discussion and not for now. But we had realized that our local capacity or local manufacturing was almost zero. and we were importing the very, very basic requirements for a pandemic response. That then led to several other conversations. Of course, the health master plan is in play, etc., to see what is it that we are doing incorrectly, or how are we not making it as such that private sector cannot manufacture? What is the problem? Next, you can just go 3 down for me, thanks. So basically, we looked at capacity building during this process, and I talk about an enabling environment, and it's another conversation, but we are having those discussions now to say, why can't we produce locally? What are the barriers that we need to look at to stop us from producing locally? I think just as an example, we look at the regulatory environment, we look at the volume and capacity. If we supply just for South Africa, it's not sustainable for private sector. Can we then expand that into the continent to say, we'll make agreements in place so that we can manufacture for the rest of the continent to make it viable for industry? And lastly, what we looked at, and I think this was quite important for private sector, next slide please, is compliance and governance. And I think as private sector, we were really, really concerned that when procurement practices came into play, that things slowly slid down, I think 2 or 3 weeks afterwards. And I'll give you an example in that companies who were already licensed to import PPE, already had the quality mechanisms in place, already had the necessary standards and specifications, they were then pushed to the wayside to some extent. And we saw different companies bringing in PPE. We had travel agents, we had people who were doing completely other products that they were bringing in, now going into the healthcare sector. I think what we'd look at in the future is that we need to look at procurement that actually has compliance and quality in mind. And one of the big watch-outs for the COVID pandemic, and we know this through the SIU and investigations that are ongoing, is it just became a real, I wouldn't say a free-for-all, but the procurement practices were put into emergency mode, and then we saw companies coming in and all the associated activities where unlicensed, unqualified importers and companies were bringing in products when they shouldn't have. We know that we have existing frameworks, policies, and institutions. We relied on those heavily, but those existing policies and frameworks did not come into play during the pandemic. I think what we want to see in future as private sector is that we have procurement mechanisms that are quite robust within the private sector. We want to share those practices with government. When there's an emergency, do we need to start buying from wherever we can? Do we lapse our governance and compliance requirements? And we really, really need to look at that if private sector is to partner and be a very, very active player in the role of a pandemic. Thank you.
Fantastic, Avanti. And you finished 40 seconds early. Wonderful, wunderbar. So that presentation was actually excellent because since we're running out of time and it summed up pretty much everything that everybody said in terms of what is important in the role of private sector, I think we'll just leave it to that. We have been told that we can't take any questions, so if you have any, just corner us somewhere in the lobby and ask us whatever you need to ask. Thank you so much. Thanks for attending. A big round of applause for my wonderful and friendly panel. Thanks a lot.